Good day. In this video, we will be discussing concepts pertaining to infections caused by viruses and even some bacteria. But generally, we will be dealing with most respiratory infections. So, for this discussion, we will be looking into these infectious conditions, measles, German measles, chickenpox, influenza, COVID-19, pulmonary tuberculosis, pneumonia, diphtheria, pertussis, and mumps. So, I will try my best to discuss this as vividly as possible, pero in a short amount of time. Okay, so I hope you are all prepared na for your exam. Now, let's talk first about measles. We are all aware what measles is. Okay, so measles is a condition that is considered to be highly contagious and exanthematous. Okay, kasi meron siyang lumalabas na mga rashes. And this is also vaccine preventable and commonly affects children. Now, this is just a simple fact sheet about measles. So, in Tagalog, we call measles as tigdas. Ayan. The reason or the cause for measles is a measles virus or a measles morbillivirus. Now, this is a single-stranded RNA virus, okay, with one serotype. And yon, it comes with, or rather, it belongs in the genus of Morbillivirus in the Paramyxoviridae family. Sa iba makikita mo yan as Paramyxovirus. Okay, sa ibang mga references, it's Paramyxovirus or Paramyxovirus. But again, it's just the same. We are still referring to the same type of virus. Now, the mode of transmission of measles, though we can see measles basically sa skin. However, ang transmission ng measles, it's not actually skin contact, no? The transmission of measles is through droplets. It could also be through indirect transmission with freshly contaminated fomites. So, when we say fomites, these are materials, okay? Let's say, mga panyo or tissue, di ba? It is an object, okay, that serves as a vehicle by which this viruses is being transmitted from one person to another. Now, the average incubation period of measles is 10 to 12 days. So, throughout the discussion, when we say incubation period, so we are familiar with that. This is the time by which the symptoms may appear. This is where the microorganisms actually tend to multiply kung saan man yung kanilang target organ. Now, in some cases, they have recorded shortest incubation at 8 days. Okay, and some would have it, may mga recorded na 20 days. Pero, again, it's not so much, kaya nga on the average, it's 10 to 12 days. Now, you would be asking, kailan siya mas nakakahawa? Okay, you'd be asking about the period of communicability. Now, for measles, as long as the rashes are there, they are still considered communicable. And they are most communicable at the height of the rash. Yung very peak ng mga rashes nila, no? And again, that's the reason why measles is called exanthematous kasi nga, it's because of the eruption of these rashes, okay? That's basically the pathognomonic sign of measles. And it's not in the skin, okay? So, if you think ng pathognomonic sign ng measles ay rashes sa skin, well, I'm sorry to say, pero hindi, okay? The pathognomonic sign of measles is actually the rashes that can be found on the buccal mucosa, okay? If you can see, it's on the image. Yan yung mga tinatawag na mga Koplik spots. Ayan. So, I hope na isulat nyo to dun sa inyong So, it's Sorry, wrong spelling. Okay, wait lang. Let me just correct that. Koplik spots. Koplik. Ang pangit ng sulat ko. Okay, Koplik spots. Okay? So, again, that's the first sign na talagang masasabi natin it could be measles. So, kasi there are many viral exanthem conditions. Pag sinabing viral exanthem, these are viral infection that causes rashes, okay? Napakaraming mga conditions na yan nga kinoconsider as viral exanthem. Pero ang one way to distinguish a simple viral infection to measles is the presence of Koplik spots. Sa iba ang rashes nila sa skin lang. Pero si measles, again, you can see the rashes inside the buccal mucosa. Okay, kaya ang pathognomonic sign ng measles, again, is the Koplik spot. Okay, so rashes is indeed a very definitive sign of measles. Pero mas definitive yung Koplik spots. Definitely. Okay, talagang kapag may Koplik spot, kaya siya tinawag na pathognomonic kasi yun nga yung talagang definitive sign ng infection na yun. Pero apart from that, it is also characterized by the presence of rashes. The rashes of measles are maculopapular in nature. So when we say maculopapular, you can see that the rashes are a little bit elevated, and of course there is that discoloration. Okay? And then it happens on cephalocaudal. So it first starts at the hairline, behind the ears, then it goes down to the trunk, and then to the limbs. Then it may also be accompanied by its confluent. There can also be desquamation and of course pruritus. So it could be very itchy. Actually, that's one thing very difficult when it comes to measles. Yung itch brought about by these rashes. Now, there are various phases, okay, in the presentation of signs and symptoms of measles. So, hindi agad-agad or hindi all throughout puro rashes lang. Now, apart from that, the other signs and symptoms are again associated with certain phases of the infection. Now, the first phase of the infection is the pre-eruptive phase. So, when we say pre-eruptive, this could happen even before the rashes. The rashes on the skin would happen. Kaya kung mapapansin nyo, you have there the Koplik spots. Nandyan yung pathognomonic sign. You can immediately see that. So, apart from that, there can be high fever. And then, you have also the three C's. So, when we say 3 C's, tingnan nyo, diba? There can be cough, colds, and conjunctivitis. Okay, so you can see that the eyes of the child in this image is, red, no? It's inflamed. Apart from, syempre, crying, mamumula talaga siya. So, you have conjunctivitis, again, cough, and colds. Yun ang sinasabi nating 3 C's. Then, there can also be photophobia. Ibig sabihin, mabilis silang masilaw. And then you have the presence of the Stimson line, which is the puffiness of the eyelids dito lang sa may bandang, linear congestion of the lower conjunctiva. Ayan, ito, may puffiness dito sa area na to na even without crying, parang namamaga siya. Okay, so that is the Stimson line. Okay? Now, the second phase of measles is the eruptive phase. So, eruptive, this is when you can already see that the rashes are already present. So, again, the rashes of measles are described as maculopapular. Okay, so these are reddish, there is that blotchy appearance, and it's also known as morbilliform rash. Okay, so again, cephalocaudal, so it first appear on the hairline, then goes down behind the ears, and then go down to the trunk, then sa limbs. So, this is the exanthem sign of measles. Okay? So, exanthem. So, there is that eruption of rashes. Now, the last phase of measles, the last phase of measles is the post-eruptive phase. So, it is characterized by the brany desquamation. Okay? So, it seems like the skin is peeling off. Okay, so yun. Now, in severe cases, in severe form, some would call this as black measles kasi yung iba yung redness nung rashes, nagiging itim siya eventually during the post-eruptive phase. So, it will fade, then it will peel off eventually. Now, in some cases, merong mga nagkakaroon ng hemorrhagic rashes, epistaxis, which is nose bleeding, melena, which is, tawag dito, fresh blood, black tarry stool, di ba, melena. And then, yan, there can also be marked toxicity. Now, apart from all of these signs and symptoms, measles also has various complications. Ayan. Measles can lead to pneumonia, again, being this as, respiratory infection. So, you also have encephalitis. Ayan, merong iba na nagkakaroon ng subsclerosing panencephalitis. So, pan, ibig sabihin, it's lahatan, di ba? Then, some would develop diarrhea, some would develop otitis media as well. Okay? Now, how do we manage individuals with measles? So, definitely, bed rest is important. Symptoms must be relieved. So, ano ba yung mga symptoms na yan? So, definitely, you have to manage fever. But again, this is a viral infection, ha? So, when we talk of viral infection, especially among children, we avoid giving aspirin, okay? Avoid giving aspirin for viral conditions among children. So, definitely, that would be paracetamol. Okay, so paracetamol for fever. Again, you would be asking bakit bawal ang aspirin. Aspirin among children, kapag ang cause ng infection ay viral, it can actually trigger Reye's syndrome. REYE syndrome. Okay, so mamaya babalikan uli natin yun. Then of course, proper health teaching. So this is a respiratory infection, so you have to follow respiratory hygiene. You have to do concurrent and terminal disinfection. So pag sinabing concurrent, habang nandun pa yung client, nililinis na, patuloy na dinidisinfect yung paligid, then definitely terminal disinfection. So this pertains to the disinfection of the site, okay, after the patient was discharged or after the patient was actually completely treated na. So, syempre, we have to follow droplet and airborne precaution. And since there is photosensitivity, so you have to protect the eyes of the patient from glaring of strong light. Lalo na if they are lying down on bed, usually nakakasilaw yung ilaw ng kwarto. So, you have to make sure that the eyes are well protected or else it may cause discomfort. Okay? Next, syempre you would be asking, ma'am, paano natin maiiwasan ng tigdas? Now, the number one way on managing or rather preventing viral infection is, of course, immunization. So, if the vaccines are available, then it's best to be immunized. By the way, ang immunization, meron diyang target ang gobyerno. Measles is one of the vaccines that are being included or that are included in the National Immunization Program or the National Program for Immunization. So, you have to remember that for those program, laging may target ang gobyerno. So, for measles and for other childhood immunizations, the targets are usually 3% of the population. Okay, so that's the safest number. 3% of the population, ganun mag-target. Now, let me just write it down here. So, again, ang target natin ay 3% of the population. So, if the barangay has, let's say, 1,000 inhabitants, then ang target nila for measles vaccine is 30. Okay, so 30 individuals or 30 children. Yun ang kanilang target. So you have to remember again, the target will always be 3% of the total population. Then of course, prevent transmission by proper disposal of nasopharyngeal secretions and always cover the nose and the mouth whenever they cough or they sneeze. So, remember the chain of infection. So, you have to break the chain of infection for us to properly manage these type of conditions. Okay? Now, moving on, let's talk about German measles. Ayan, sorry, hindi ko na naalis yung part ng definition. Okay, so German measles, ayan, medyo malapit din to kamag-anak ni measles. So this is also caused by a viral infection, specifically caused by rubella. Okay, the rubella virus. So this is usually known as rubella, Rothern disease, 3-day measles. Then in Tagalog, usually they call this as tigdas hangin. But then again, this is still contagious. So the mode of transmission is also droplets and airborne. Now, incubation period, it's quite longer as compared to measles, no? The incubation period of German measles is between 14 to 21 days. So that's about 2 weeks to 3 weeks. So medyo matagal. Kaya, syempre, pagdating sa tracking nito, when you try to trace yung pinanggalingan ng infection, usually you have to go back 2 weeks before or 3 weeks prior. Okay? Now, the communicability period, okay, nakakahawa siya 5 days before and 5 days after the rash. Okay? So, the signs and symptoms of measles would include, it's quite the same as measles, pero ang differences nila, okay, pareho silang maculopapular, pero ang German measles, diffuse siya, kalat siya. It's not confluent, di siya sanib-sanib, kalat siya. There is also no desquamation, so wala siyang parang dryness, yung parang nagpipeel off, hindi rin. But the same, it's still cephalocaudal. So it spreads from the face downwards. And then, the pathognomonic sign is Forsheimer's spot. So that's also the red lesion on the buccal cavity or the soft palate. So it's not really a spot. Okay? So it's called Forsheimer. So it's a lesion. So medyo malapit sa itsura ng complex spots din natin. Then it can also manifest as initially as cervical lymphadenopathy. Okay, so kaya isa rin sa mga 'di ba, ina-assess natin would be the lymph nodes. Okay, and then the fever for German measles is just low grade. Hindi katulad ng measles na pwedeng na magkakaroon ka ng high grade fever. So low grade fever lang ang German measles, but still, okay, ano pa rin siya, contagious pa rin siya. Now, German measles, can lead to pneumonia. It can also lead to meningoencephalitis, thrombocytopenia, sinusitis, and otitis media. Now, one thing na very significant for German measles is that it's maternal and fetal complications. So, kapag yung buntis nagkaroon ng German measles, there are many complications. If the infection happened during the first trimester, now, it can lead to congenital abnormalities. It can lead to mental retardation, it can lead to cataract, or the blueberry muffin skin. Blueberry muffin skin, parang, alam niyo yung blueberry. So, yung skin niya parang may mga bilog-bilog. Okay, may mga bilog-bilog, may mga parang purplish spots all over. So, kaya siya tinawag na blueberry muffin skin. So, those are the possible complications, lalong-lalo na for the first trimester. Pero, if the infection happened, okay, if the mother had the infection during the second trimester, it can lead to abortion. On the third trimester, it can lead to premature delivery. So, yan. Now, let's move on with, with the drugs. So, for older clients, you can give aspirin. Pero again, for children, it's best to use paracetamol. Now, no need for any topical or systemic medication. So, no need to put anything on the rashes. Walang effect yun, okay? Diversionary activities kasi nga makati rin siya. So, it can also have that itch, okay? Then, yan, the reason why pregnant women must never receive rubella active immunization kasi nga it can lead to reinfection. So, in most cases naman, when you had the infection, it can also infer lifelong immunity. So, the same, if you can see preventive management. So, there is rubella vaccine. So, it's also part of the National Program for Immunization or the National Immunization Program. Okay? Of course, proper disposal of nasopharyngeal secretions, then respiratory hygiene. So, proper covering of the nose and the mouth when coughing or sneezing. Next, we have chickenpox. Sa Tagalog, bulutong. Okay? So, hindi ko pala nailagay. Chickenpox is bulutong in Tagalog. So, most commonly known also as varicella. Now, the causative agent for chickenpox is, well, it could be herpes zoster virus or it could also be varicella zoster virus. Now, if you think that herpes is only sexually transmitted, then it's not. Okay, herpes zoster, ayan, it can also lead to chickenpox and it is transmitted via droplets and airborne as well. Kaya nga, itong mga discussion natin, it's really respiratory. So, ang inoculation niya nangyayari yan sa respiratory tract. Then, doon siya locally nagre-replicate. Then, eventually, nagkakaroon ng lymphatic spread. So, kaya siya pumupunta sa iba't ibang parts ng body. And even the manifestation, pwedeng nasa skin, nasa brain, no? So, those things we have to remember. Now, the incubation period of chickenpox is at 10 to 21 days. Now, the same, the period of communicability can happen 1 day before the rash and 6 days after the first crop of vesicles. When it's a first crop of vesicles, yung first na paglabas ng mga vesicles. So, if you can remember the different types of skin lesions na discuss sa inyo nung palang health assessment ninyo, when we say vesicles, these are fluid-filled skin lesions. Okay? Yeah. So, that's how it looks like. So, you have the maculo-papulo-vesicular rashes. So, maculo, so they are elevated. There are discoloration. Yun pala yung maculo, there is discoloration. Papulo, you have the elevated lesions. Then, vesicular, it is fluid-filled. Okay? And you can also see chickenpox even in the covered areas of the body. Now, the spread of chickenpox is centrifugal in nature. So, nag-uumpisa siya sa face, saka sa trunk, and then saka siya lumalabas sa gilid. Okay? And then, it also leaves a pitted scar or pock mark. Okay? Okay, so one thing to remember with chickenpox is that it can also have long-term complications. So, it can lead to furunculosis. When we say furunculosis, there is the occurrence of furuncles or boils. Parang usually nagkakaroon, hindi na nawawala yung mga boil-like structures dun sa skin niya. And mas madami pa siya. There can also be erysipelas or it's a form of skin infection. And it's usually caused by a strep infection. So, streptococci infection. And then, you have meningoencephalitis. Now, another thing, okay, sa chickenpox, or should we say na, that older the person is, so for adults, mas mataas ang chances for complications to happen. So, kapag nangyari yung chickenpox early, kasi pag isang beses ka na nagkaroon ng chickenpox, it can already give you lifetime immunity. Okay? So, kapag ang chickenpox ay nangyari ng bata pa lang, usually the complications are lesser. Pero kapag nangyari ang chickenpox ng adult na, ayan, that's when you would expect these complications to happen. Now, another thing, akala natin pwedeng walang complications, pero one thing you have to remember with chickenpox is that it can also remain dormant. The virus can actually stay in the nerve cells. They can remain dormant at the dorsal root ganglion. Okay? And eventually, it can lead to shingles. Okay? So, yung shingles, para rin siyang, ayan, herpes infection din siya. And then, kapag nagkaroon ng eruption ng mga vesicular rashes, it also involves myalgia. So, it can also lead to pain. Okay? So, pwedeng masakit din siya. Ayan. Usually, ito yung talagang isa sa mga complications na makikita natin sa adults. Pwedeng chickenpox sila ngayon, then after some time, after months or years, magkakaroon sila ng shingles. Mag-reinfect siya as shingles. Kasi nga, remember, this is virus, so it can just stay dormant, okay? And then, eventually, pwede siyang mag-cause uli ng symptoms. Now, the treatment for chickenpox, ayan, you can give oral acyclovir. Acyclovir is an antiviral drug. So, we usually give 800 milligrams 3 times a day for 5 days. Definitely, strict isolation must be observed. Then, it's very itchy. So, you can give local or systemic antipruritic. So, yung mga cetirizine, ayan, pwede ka magbigay niyan. And then, of course, just to ease off in a way yung nararamdaman, they can be given a cool bicarbonate of soda baths. Okay, that will also avoid further infections of the vesicular rashes. Calamine lotion also for itch, and then of course, antihistamine. So, yan yung mga local at systemic antipruritics natin. So, definitely, calamine is local, antihistamines are systemic, then cool bicarbs or cool bath are also local. How do we prevent chickenpox? Paulit-ulit. It's still immunization, proper disposal of nasopharyngeal secretions, and of course, covering of nose and mouth. Kasi remember, the mode of transmission is airborne or droplet. Now, moving on, we have influenza. Now, influenza is most commonly known as flu. We usually call it trangkaso. Okay, so it's caused by a mix of virus. And we have 3 types of viruses. You have influenza virus A, B, and C. And we will talk about these types of viruses in a little while. Okay? Mode of transmission of flu is also droplet and possible contact with nasopharyngeal secretions. Incubation is at 1 to 5 days. Now, these are the different types of influenza. You have A, B, and C. Pero meron pang D, yun lang kasi ang D, it doesn't infect humans, okay? So, it just infects the cattle. Now, influenza A, so, ang source ng infection are animals, but it can also infect humans. So, influenza A is one of the most common type of influenza that usually causes epidemics and pandemics, okay? So, if you are familiar with avian flu, with swine flu, ayan, they are all part of the family. They are all part of the influenza A family. So, subtypes of influenza A would include, ayan, avian. So, galing to sa mga birds. So, you have there H5N1, H7. We will talk kung saan galing yung H at yung N na yan. Okay? Swine flu. Okay? Swine flu, nakikita naman natin, familiar tayo dyan, di ba? It's just recently, yan. We are affected by this before COVID. We have ASF. So, that's swine flu. So, it can also infect humans. So, you have H1N1, H1N2. You are familiar with this kasi if you have heard of yung mga dating mga naging epidemics lalo na dito sa Asia, 'di ba? So, and H1N1 nangyari yan, SARS, 'di ba? And we will talk about SARS later. So, yun. Then you have influenza B, rather, it mainly infects humans, pero influenza B is actually a common influenza. So, ano lang to, hindi siya as complicated as influenza A. And it doesn't cause epidemics and pandemics. So, influenza C is also, ayan, it can infect human, pigs, okay, but it's quite rare as compared to A and B. Now, ano HPAI and LPA, that is high path or low path um, infection. Okay? High path or low path infection. So, ano naman yan? It's on how it's the ability of the virus to kill chickens pagdating sa labs. Okay? So, dito yung nakikita nila. Pero, definitely among human beings, so, the test will just show us the virulence of the virus. Now, as I am saying kanina, if you can see, you have two letters there, H and N. Now, H and N pertains to the two types of surface antigens that is found on the influenza virus. Now, it could be the presence of hemagglutinin and neuraminidase. So, that's H and N. Okay? Kaya siya H1, ibig sabihin, that's the first type of hemagglutinin. Then, of course, N1, so it's the first type of neuraminidase. So, mas tumataas yung number, ibig sabihin, bago yung presentation nila as compared sa previously identified na antigens. Let's just talk a little bit about avian influenza. So, this is H5N1 virus. Now, of course, ito wala pang vaccine to, pero this has caused epidemics in some Asian countries. If you can remember, several years ago, we are discouraged to eat chickens. Okay, it's because of avian influenza. Okay, so it can be felt as fever, body weakness, muscle pain. Then you also have cough, sore throat, and sore eyes. Then definitely respiratory, so difficulty of breathing may also be manifested. Now, influenza in general can be manifested as chills. Then, of course, you have fever. Ayan, so it can range from 38 to 40 degrees Celsius. There can be headache, myalgia, so there is muscle pain, and then non-productive cough. Occasionally speaking, pwedeng magkaroon ng laryngitis, hoarseness, you have conjunctivitis, rhinitis, and rhinorrhea. Now, the symptoms here usually subsides in 3 to 5 days. And it can also be associated with nausea and vomiting. Now, how do we know if it's flu? Ayan, syempre, for us to identify what type of strain the virus has infected us, or what type of strain the virus that we have is, so you have nose and throat swab, viral culture, viral serology. This is the reason why they can identify if it's H1N1, H5N1. So, all of those types can be tested, okay? And that can at least give you a definitive type kung ano ba yung infection na meron ka. As for the treatment, so we usually give symptomatic treatment. Then again, we have to avoid aspirin. So, kaya kapag may flu, may trangkaso, diba, it's usually paracetamol, okay? So, we don't give aspirin because, again, it can lead to Reye's syndrome. R-E-Y-E. Ayan. Reye's syndrome. So, it's actually fatal, and it is triggered by, okay, kasi wala naman talaga, quite idiopathic tong Reye na to, pero they have seen that most clients who had this type of syndrome had history of viral infection and they took aspirin. So, kaya they have correlated that presence of aspirin into the triggering of Reye syndrome. Then you can give amantadine, of course. Amantadine, it interferes the penetration of virus into our own cells. Then, zanamivir naman is also an antiviral drug. So, that's an antiviral drug. Then, of course, don't forget to ask the patient to isolate themselves. Then, of course, observe bed rest. If you can see, preventive management will always be immunization. So, flu vaccines are given on a yearly basis. This is one thing na tandaan natin na kakaiba with influenza. Sa ibang mga infection, measles, German measles, chickenpox, once you had it, okay, may lifetime immunity ka na. Pero for influenza, hindi. Kasi nga, one characteristic of this virus is that it can evolve into various strains. So, pwedeng yung vaccine ngayon or the type that infected you now will be another type sa susunod naman. Kaya mai-infect ka uli. So, ibig sabihin, the antibody that you have, okay, may be different from what was needed. Okay? So, kaya, that's also the reason why napakaraming mga, ng influenza. May mga pentavalent na nga yan, maraming mga klase ng influenza vaccines, and also the recommendation for flu vaccine is on a yearly basis. Okay, yearly. Now, since we are talking about respiratory tract infection, medyo malapit pa rin sa influenza. Of course, you have COVID-19. But before we talk about COVID-19, kasi tawag dito, COVID-19 is caused by coronavirus, okay? Kaya nga siya tinawag na COVID-19. That is coronavirus disease. Then, it was first documented in 2019. Kaya siya tinawag na COVID-19. Coronavirus disease of 2019. Now, bakit ko ine-emphasize yung coronavirus? Kasi, pag-usapan din natin ang SARS or Severe Acute Respiratory Syndrome. Causative agent is also coronavirus. Then, it is transmitted via airborne and also droplet. And, of course, foam mites. Okay, incubation period is at 2 to 7 days. Okay, and then as SARS also have given us fair share of worst experiences in the past, di ba? Nagkaroon din yan ng epidemics again dito sa Asia. So you have SARS. MERS-CoV is also part of the family, the Middle East Respiratory Syndrome coronavirus. Ayan, so mga magkakapamilya yan. SARS-CoV, di ba? Kaya siya tinawag na SARS-CoV. Ayan. So, yun din yun. It's coronavirus. Pero ngayon, the topic at hand is COVID-19. Now, we know COVID-19 was previously known as nCoV. Okay, bakit siya nCoV? Kasi novel coronavirus. Okay, pero hindi siya novel. Because when we say novel, that's new. Now, every day diba, it mutates. Okay, so naiiba siya. And one thing can't stay novel forever kasi eventually merong ibang ma-identify pa, no? So, droplet and airborne is the mode of transmission. Incubation period, before kasi the incubation period is at 2 to 10 days. Okay, 2 to 10 days, yun yung standard na incubation period ni COVID-19. Okay, and then, let's have the signs and symptoms of COVID-19. You are all familiar with this. Okay, so mabilisan lang. Of course, you had intermittent fever, chills, headaches, body aches, dry productive cough, then definitely there will be hypoxemia. Kaya isa sa mga tinitingnan natin dito, apart from respiratory rate, is the oxygen saturation rate. Okay? So, yun, there can also be dyspnea because of the loss of aerating surface, and in some, it affects the receptor sites. So, there can also be loss of smell and loss of taste. Now, how can we diagnose COVID-19? Now, of course, familiar na tayo dito. Siguro lahat tayo naka-experience na nito, no? Pero, the diagnosis for COVID-19, the most definitive is reverse transcriptase polymerase chain reaction, or RT-PCR testing. So what they do is they amplify the nucleic acids found in the sample. So nakikita nila yung genetic characteristic talaga. And one thing with viruses, 'di ba? It's gene it has DNA, 'di ba? Yun ang ng virus. So that's the reason why RT-PCR testing is the most definitive. Pero syempre sa ngayon you have antigen testing, okay, for SARS-CoV-2. Okay, so antigen testing is still not definitive. Kaya nga 'di ba, it will just give you a heads up, wait lang, positive ka or negative ka, but still if you want to have a definitive test, it must be RT-PCR testing. Now, COVID can also be diagnosed through imaging. So you have the ground glass opacification. 'Di ba? Look at that, 'di ba? Para siyang may mga durug-durug na may durug-durug na glass. Then it's dispersed, okay? This is indicative of viral pneumonia. Ibig sabihin, it could be a virus, okay? So kaya isa 'yun sa mga kino-consider. But remember that these radiologic abnormalities is not, again, a definitive form of diagnosis. You cannot diagnose someone with COVID-19 just because of the diagnostic imaging. So, babalik ulit tayo sa RT-PCR. Lalong-lalo na if your client is just a suspect, walang RT-PCR result, or there is negative RT-PCR. There could be other reason for the pneumonia to happen. It may or may not be COVID-19. Now, also in COVID-19, there are various levels of severity. You have the non-severe COVID-19. So, there are no signs of severe or critical COVID-19. So, usually, ito yung pwedeng may fever, may cough, may colds, okay? But other than that, okay naman siya. Severe COVID-19, ito yung bumababa na yung oxygen saturation of less than 90% on room air. There is fast breathing at more than 30 breaths per minute for adult, which is normally dapat 20 lang. And then, of course, there are severe signs of respiratory distress. So, you can really see that the patient is having trouble with breathing. Now, critical naman, ito yung lahat yan present. And then, usually, it's associated with sepsis or septic shock. Now, it is critical COVID-19 that would really require mechanical ventilation. Severe COVID-19, it may require hospitalization. Non-severe COVID-19, no need for any forms of hospitalization. Home care will be sufficient. Now, clinically speaking, COVID-19 can lead to pneumonia. Okay? Kaya nga, isa yan sa mga tinitingnan kapag may COVID-19 kung meron ng pneumonia. Okay? So, these are the various signs and symptoms of mild pneumonia and severe pneumonia. So, kindly take a screenshot and read this thoroughly. Okay? Now, how do we treat COVID-19? COVID-19 is treated by means of both drugs and non-pharmacologic management. Now, this is non-pharmacologic. I apologize if I haven't changed this yet. It's non-pharmacologic. So, you can give oxygen. Okay, most especially for those with severe acute respiratory infection, those who manifesting respiratory distress, hypoxemia, or shock. Okay, so we really have to give oxygen. Now, another non-pharma approach in COVID-19 is the awake repositioning pruning protocols. So they have found out that there is increased oxygen saturation, okay, when you put the patient on prone position, pag idinadapa sila. Okay, so that's the reason for the CARP, COVID-19 Awake Repositioning Pruning Protocol. So you put the patient on prone position for a few minutes, and then on the side, and then on their back, then go back again to prone position. That is again to promote better saturation of oxygen in the pulmonary capillaries. Now, you can give IV fluids, but it's not necessary. IV fluids can actually lead to problems with circulation. Then it can also lead to other respiratory complications. So that's why we only give IV among clients who are already manifesting signs of shock. Okay? So yun. Drug management, no need for antimicrobials. Okay? Pero yung mga tocilizumab, remdesivir, ayan. So it can be given pero they are not required. Lalong-lalo na if the condition is mild or moderate lang, no need for those types of antimicrobials. Now, we only give neuraminidase inhibitor if, if there is known local circulation. Okay, pwede ka magbigay ng ganong forms ng antimicrobial. But if you have not yet identified the presence of any of these virus, then again, no need for antimicrobials to be given. So, home care management, you are already familiar with this. We know this, okay? So, proper ventilation, observe isolation protocols, do not let them use the utensils being used by others, diba? So, always maintain social distancing, limit the number of caregivers, then totally avoid any forms of visitors. Now, as symptomatic lang din naman yung management natin for COVID-19. So, syempre, paracetamol if there is fever or pain. At some point, you can also give some forms of NSAIDs. Okay, if paracetamol is no longer effective. Okay? Then you can give nasal decongestants, okay? Just to relieve you of nasal congestion and rhinorrhea. Rhinorrhea, ito yung tumutulo yung sipon, okay? Na hindi mo makontrol. Parang tubig. Then, honey, they have seen. By the way, these information on COVID-19 are all taken from the World Health Organization and the Center for Disease Control. So, again, no need for any forms of antibiotics. Now, how do we prevent? Of course, lagi yan. Ngayon, meron ng immunization ng COVID-19. So, we are all encouraged now to be immunized against COVID-19 through the second booster na. Diba? So, yun. You are all familiar with this. We have been doing this for 2 years already. So, it's already part of our routine, diba, on how to prevent COVID-19. Syempre, huwag kakalimutan ng PPE, ang social distancing, diba, proper hand washing, and of course, respiratory hygiene. Okay? Next, let's talk about pulmonary tuberculosis. Okay? Pulmonary tuberculosis, so it affects the lung parenchyma. It's also known as Koch's disease, thesis in Tagalog, yan. Thesis pa nga yan. Galloping consumption, and of course, TB. Okay, causative agent of tuberculosis is Mycobacterium tuberculosis. Now, there's also one form, pero ito kasi ay nag-originate sa cattle. So, you have Mycobacterium bovis. Okay? So, sa cattle siya nag-originate. Now, the mode of transmission of pulmonary tuberculosis is droplet infection. Then, of course, kasi ang M. bovis nga, sabi nga natin, galing yan sa cattle. So, it can also help transmit, or the milk that you have taken from the cow can also transmit the infection. Okay? So, pwede yan. Pwedeng magkaroon din ng Mycobacterium bovis, yung milk ng cow na, yung milk ng cow. Okay? So, kapag uminom ka ng gatas ng cattle na infected ng M. bovis, then you can be infected also with M. bovis. Okay, incubation is at 4 to 12 weeks. So, masyadong mahaba. Pero for some have recorded 2 to 10 weeks. Okay? So, yun. As incubation period. Okay? So, this is tuberculosis. So, it is characterized by cough, afternoon fever, weight loss, blood-stained sputum, and of course, night sweats. So, yan. Diagnostic test for TB is, of course, our, gram staining. 'Diba? So, you identify the presence of the bacteria in the blood. Then, here, of course, chest x-ray. So, yan, nakikita nyo, yan. That's the one thing that we have to consider kapag tuberculosis. Then, you have this. This is for PPD or purified protein derivative. Okay, so usually after ID, intradermal infection, intradermal injection of the PPD. So, magpo-form ka ng wheal, then you have to wait for the response of your body. Okay, so yan. Now, another test that can be done for pulmonary tuberculosis is the AFB smear. Ayan, so that's the acid-fast bacilli. So, through proper staining, ayan, you'd be able to isolate these bacteria. Now, of course, you can use chest x-ray and that will help us determine the involvement of the lungs. Ito, sabi ko nga, that's the PPD or purified protein derivative. It's also known as tuberculin testing or the Mantoux test. Okay, so what we are actually waiting for is the presence of induration. If the induration is present like this, okay, so ayan, pag ganyan ay, ano na yan, tawag dito, positive ka for PPD. Pag positive ka sa PPD, hindi ibig sabihin meron kang tuberculosis, no? But then you are exposed to someone with tuberculosis. Now, there are 3 classifications of pulmonary tuberculosis. You have minimal, moderately advanced, and the advanced. So, that depends on the degree by which it is infecting the client. Okay, so you have minimal, moderately, and advanced. Now, this is the category of tuberculosis. Ito yung mas ginagamit, the WHO classification, where your patient falls under category 1, so that's new cases plus sputum plus seriously ill. Or category 2, these are those who have relapsed and those who have failed the treatment. You also have category 3. Okay, so this is where you can see that there is problem with the X-ray machine. Okay, nakita na yung problem doon. Pero, konti lang. Then, kapag nagpa-check ka ng sputum, negative naman. So, kaya they will be falling under category 3. So, here are the treatments. So, pag sinabi nating R, that is rifampicin, I is isoniazid, P is pyrazinamide, and E is ethambutol. Okay? So, yan. Yan yung RIP. S is streptomycin. Okay, so again, DOTS naman, this is the government program by which it ensures that clients who have tuberculosis are really taking their medications. So, kaya siya directly observed treatment short course because you are actually looking into the client, making sure that the client is taking in the drugs. Okay, talagang iniinom nila yung gamot in front of the healthcare worker. So, tandaan, for tuberculosis, 2 to 4 weeks after the intake of drugs, the patient is no longer considered to be contagious. Okay, so these are the drugs that are part of the TB program. So, of course, you have rifampicin. Though, kanina nandun na siya, no? I would just like to inform everyone na kapag rifampicin, ayan, it can cause changes, it can cause discoloration of the urine. So, isa yun sa mga implications ng rifampicin. Of course, what do we have to do? Always give the drug before meals or at bedtime. Then, do not take alcohol when they are taking rifampicin because it can cause drug reaction. Okay? Of course, you have isoniazid, INH. So, yan. Side effects naman nito would be tingling and numbness of the hands and the feet. Okay? Now, usually, okay, this must be given on an empty stomach. And then, we usually give vitamin B6 together with isoniazid because nga, it causes peripheral neuropathies. Then, the same, do not take alcohol along with this drug. Now, ethambutol, it can cause optic neuritis. So, yan, you can give aspirin or NSAIDs for the pain. Now, there are also drugs being given for resistant patients. Okay? So, kasi diba, when they are not taking the drugs properly, ay nagkakaroon ng drug resistant. So, they can be given capreomycin, kanamycin, para-aminosalicylic acid, cycloserine, chemoprophylaxis such as isoniazid, and vitamin B6. Okay, so, syempre, isa sa mga manifestations ng tuberculosis is sudden weight loss. Okay? So, if they have very poor appetite, so just give them small frequent feedings. And then, of course, pinakamahalaga would be strict compliance with the drug regimen. Now, do not promote chest clapping or chest physiotherapy kasi that can further promote hemoptysis. Okay, hemoptysis is coughing out of blood. Okay? Preventive management, so we give immunization, which is BCG, birth 1, okay, at birth, then 1 dose lang siya at the right deltoid. So, it can cause TB meningitis. Then, the same proper disposal of nasopharyngeal secretions, and then, covering of the nose and the mouth whenever you cough or you sneeze. Next, we have pneumonia. So, by the way, ito palang mga dinidiscuss natin ngayon. Simula tuberculosis hanggang pneumonia. Hindi na to viral infection. Pero still, respiratory infection naman siya. Tuberculosis caused by a bacteria. Then, pneumonia naman, it can be caused by so many things, okay? It can be caused by a bacteria, by a mycobacteria, by fungi, and even by viruses. So, you have there the many causative agents of pneumonia. So, mode of transmission for pneumonia is droplet infection and also by means of indirect contact. Ayan. Now, incubation period of pneumonia is just 1 to 3 days. Kaya nga yung mga pasyente, kunyari, kinabukasan, nag-develop sila ng pneumonia, then there can be, it can be considered as nosocomial infection. So, after this, pag second day na siya nilagnat, it could be nosocomial. Pwedeng doon na galing sa ospital yung nakuha niyang microorganism that leads to pneumonia. Now, these are the risk factors. Sino-sino ba yung madalas or mas malaki ang chances na magkaroon ng pneumonia? Siyempre, yung mga nagkakaroon na, nag-i-insert ng foreign object sa respiratory tract, di ba? So, intubation, tracheostomy, or if there is impaired coughing reflex, so tandaan, coughing is a reflex, okay? Ang nagtitrigger ng coughing is, of course, if there is something that needs to be expelled from the lungs, so uubuhin ka nun. Okay? Now, ciliary dyskinesia, bronchial obstruction, viral infection, anatomic abnormalities, diba? So, ayan, all of those things can bring about pneumonia. Okay, so there are also various classifications of pneumonia. Pneumonia can be community acquired. So, this is when, ito nga sabi ko kanina, di ba, ang incubation period is 1 to 3 days. So, if pneumonia happens less than 48 hours from hospital admission, then pneumonia was, it could be because it was taken from the community. Pero if it happened more than 48 hours, then that is, ayan to, more than 48 hours, then that is hospital acquired. Ibig sabihin, nakuha na yung pneumonia sa ospital. Okay? Yun. Pag healthcare associated, so it could be because, yung nurse ang nagbitbit. Okay? Most especially among clients who are actually in home care. Then, ventilator associated, if it happens more than 48 hours after the insertion of endotracheal tube. So, ganito yung nangyayari sa pneumonia. Ayan. So, tandaan na laging pumapasok siya sa maliliit or nagkakaroon ng inflammation sa maliliit na airways, and that brings about crackles. Wheezing is not so common, okay? Unless it's viral infection. Mababa ang tidal volume, kaya madalas nag-i-increase ang respiratory rate because you have to maintain adequate ventilation, okay? Because if there is ventilation perfusion mismatch, then yan, magkakaroon ka ng problem with oxygenation of the client. So, pneumonia happens, okay, because of course, the susceptibility of the host. Okay, so, normally kasi, marami na tayong nangyayaring mga defense, diba, from the upper airway papunta sa baba. Kaya madalang makapunta ang infectious agents sa lower respiratory tract. Pero when there is impairment of host defenses, then it's easier. Now, there will be the release of exudates as form of inflammation. Then, because of these exudates, it affects ventilation and perfusion. So, hindi masyado magkaroon ng exchange of gases. Kasi nga, ang daming mga exudates na nanggugulo. Okay? Now, you have bronchopneumonia. If upon X-ray, you can see that there is patchy distribution of parenchymal consolidations. Or it could also be lobar pneumonia, okay, that only affects a substantial portion of one or more lobes. So, pwedeng yan yung mga pwedeng i-classify, okay, yung pneumonia. Now, pneumonia is manifested by these. So, I think nabanggit naman na to kanina, no? Pero, ang paalala lang, ang pathognomonic sign ng pneumonia is the presence of rusty or prone juice sputum. Okay? So, yan. Then, ito among children, if you can see, yan naman yung sa IMCI. I know you are familiar with this, dapat alam niyo to. So, that's part of IMCI. Kasi, di ba, isa sa mga conditions na kinokorek at tumutulong tayo nung i-manage ay pneumonia. Diagnostic test natin, of course, this is pneumonia. So, you have to know exactly ano ba yun. Kasi nga, it could be fungi. It could be bacteria. Okay? It could be a virus. Di ba? There are so many things that can bring about pneumonia. So, the sputum culture will actually help us identify what microorganisms are there. It can also help us identify yung production or yung reproduction rate ng mga microorganisms. Okay, so yan. Now, bronchoscopy, of course, sa visualization. Then you have radiography. Well, just for you to see, ayan, perihilar infiltrates, hyperinflation, and atelectasis. Because it can only be seen on X-ray. Kaya, radiography can still be used. Okay? However, kapag naman ang infection ay bacterial in nature, so, ayan, it can be accompanied by pleural effusion. So, there will be fluids accumulating in the lungs. So, this is pneumonia for newborn. So, again, part ng IMCI program. Okay. Yan. The next question could be, Ayan, the management of pneumonia. Now, pneumonia can be managed by means of giving antimicrobials. So, that depends kung ano yung bang sinasuspect na cause ng infection. Pero, ang kadalasang binibigay is amoxicillin and erythromycin. Okay? Then, you have mga cephalosporins yan, di ba? You have cefuroxime kapag category 2. Category 3, it could be cefuroxime or ceftazidime. Diba? So, sa mga cephalosporins ang ibinibigay natin for pneumonia. This is for IMCI classification. You must be familiar with this. Diba? Yan. So, ang basis natin for respiratory problems in IMCI is, of course, our respiratory rate. Okay? Now, this is the management. Okay, you have a sputum exam, you have chest x-ray, and procaine penicillin. Okay? So, these are the management. Ayan, i-identify ko lang, i-emphasize ko lang yung splinting ng chest. So, yun yung parang may yakap-yakap ka na pillow sa kakauubo. So, it avoids overexertion of the muscles. Diba? The chest muscles. So, kaya splinting is very much useful. Okay? Then, of course, sabi nga natin, meron din tayong pneumococcal vaccination. But then again, I think it's every 3 years or 5 years. So, yun, hindi siya yearly binibigay. Next, we have diphtheria. So, konti na lang. I hope you are still alive. Ayan, 3 conditions na lang. Diphtheria is acute pharyngitis. Okay? Ang diphtheria ay, ayan, kakaiba. Because there is the formation of what we call as the pseudo-membrane. Okay? So, ayan, the causative agent for diphtheria is Corynebacterium diphtheriae. Yan. Okay, that's the causative agent. And then, mode of transmission for diphtheria is respiratory droplets. Then, it can be incubated for 2 to 5 days. Now, ang pathognomonic sign ng diphtheria is the pseudomembrane. Now, let me just look at that. Diba, this is the uvula. Ito yung uvula. Pero look at the side, may maputing part. So, that's the problem with diphtheria. Then, you can see the neck is quite big. Now, the problem here is that diphtheria actually releases a powerful necrotizing exotoxin. So, it can actually treat this condition. Okay? Pero, tandaan, the best management for diphtheria will always be, syempre, yung management ng, ng doctor. Kasi hindi nyo pwedeng tanggalin yan. Ma'am, alisin na lang natin para wala ng toxin production. No. You cannot surgically remove, okay, yung tissue na na-form ng diphtheria. Okay? Yan. Look at that, oh. Diba? Paano ka pa makakahinga? Ayan. Paano ka pa makakahinga? So, you have the nasopharyngeal or the facial type. Yan, ganyan yung mga itsura niya. Minsan sa nose din, did you see that? Okay, sa nose din. Usually for nasal naman, there can be serosanguinous secretions, okay? Together with a foul, mousy odor. Then again, so the membrane can also reach, okay, the nasal septum. Okay, so next you have laryngeal. So again, it's the most severe and the most fatal among those. Okay, so ayan, nakita niyo naman yung opening, di ba? Okay, so imagine mag-close lang yan totally, the patient will be hypoxemic. Now, these are the complications and I think we have mentioned this already a while ago. Okay? Diagnostic test for diphtheria is the Schick test. It will help you determine your immunity or susceptibility to infection. Kasi syempre, if becomes negative, so you are quite susceptible. So, definitely, hindi mo na siya ilalagay sa mga area na merong, sa mga area na pwede siyang ma-infect. Then, you have the Maloney's test naman. It's test for hypersensitivity to diphtheria antitoxin. Okay? So, ang hinahanap niya is the toxin itself. So, that's why Maloney's test would be one of the definitive, okay, diagnostic tests to support the claim of ayan, to support, ano pa ba yun? Okay? Sorry, nawala yung iniisip ko. Pero it will help you, ayan, for hypersensitivity. So, yung toxin. That's the Maloney's test. Clinical management, of course, you have to neutralize the toxin. Okay? That's the one that causes all of the problems with diphtheria. Now, ayan. So, you can give the anti-diphtheria serum. However, skin testing would be required. You can give doses of ayan. So, if there are hypersensitivity, so you can give epinephrine or corticosteroid as an antidote. Antibiotic natin for diphtheria is penicillin. And then, you can do tracheostomy. As you can see, walang surgical management. So, ang diphtheria ay hindi inooperahan. Hindi tinatanggal yung pseudomembrane. Diba? Parang iniisip ko, tanggalin yung pseudomembrane, wala na siyang toxin. But it's actually not recommended. Okay? It's not recommended. Ano pa? Ang problem pa with diphtheria ay mahirap lumunok. Okay, diba? Mahirap kumain, mahirap lumunok. So, that's why you give them small, frequent feeding. Okay? Small, frequent feedings lang. Yan. And then, management natin, syempre, complete bed rest. Okay? Ayan. Kasi, they say na yung infection kasi from the throat, pwedeng mapunta sa heart muscles. So, kaya, ayan. To prevent myocarditis, complete bed rest lang ang client. Maintain proper airway. Then again, give small frequent feedings which I mentioned earlier kasi nga pwedeng mahirapan silang lumunok. And then masakit din yung pseudomembrane na yon. So if there is pain, then they can use ice collar. Ayan. So, ewan ko kung nag-skip or kung ano pa man, pero ito tayo. Preventive management again will always be immunization. So, immunization, diphtheria is part of the National Program for Immunization or the National Immunization Program. Second to the last, we have pertussis. Pertussis is also known as whooping cough. Okay, whooping cough. Ayan. It's caused by Haemophilus pertussis or Bordetella pertussis. Now, transmitted through droplets, incubation is at 7 to 21 days. The manifestations of pertussis are classified into 3. Of course, you have the catarrhal symptoms. That's the first. And then, nagkakaroon ng paroxysmal. Then, nagkakaroon ng convalescence or recovery. Now, when we say catarrhal, so this is when the client is highly contagious. Catarrhal, nandyan ang colds. Ayan. There is colds, cough at night, then fever, and of course, listlessness. Spasmodic or paroxysmal naman, ito yung sobrang ubo talaga ng ubo. And this is where the pathognomonic sign of pertussis is really that whooping cough. Yung parang tatawag na ubong aso. Para siyang talagang tumatahol. Okay? So, that's about 5 to 10 forceful successive coughing. Okay, which ends in a prolonged inspiratory or a woof. Ganon. Okay, may ganong woof. Okay, so woofing cough. Now, it can also lead to vomiting. Then there is teary eyes. And it can even lead to protrusion of the eyeballs because of the increased pressure. Okay? Then it can also lead to convulsions. Of course, convalescence natin, that's recovery. So this is when the coughing have already subsides. Okay, and the patient can already recover. Diagnostic test for pertussis is the Bourdet-Gengel agar plate. Ayan. So, ito, very specific tong ano na to. Etong agar plate na to for Bordetella pertussis. Kuha ka ng nasopharyngeal secretion, then ano mo siya dyan, swab mo siya dyan. Then you have to see the strand, the colonies of Bordetella pertussis. Okay, that's the most definitive diagnostic test for pertussis. Ayan. Then of course you have the management. Okay. So the drug of choice is erythromycin and or penicillin. Of course, promote proper bed rest. Okay. You prevent aspiration, lalo na kapag bata, kasi kung ubo ng ubo, di ba pwedeng habang nagmi-milk siya, then bigla siyang umupo, ma-aspirate siya. So you give them small holes of nipple for bottle feeding. Then, of course, ayan, sometimes NPO, habang siya ay ubo ng ubo. And then, of course, sometimes you can feed them also with medicine dropper. So, at least controlled yung pumapasok, okay, sa body niya. Yan. Kaya, medicine dropper. Kasi, para lang maiwasan yung ma-aspirate siya. Then, abdominal binder para ma-support ang muscles and that will at least lessen the chances of having muscle pain. Of course, preventive management, as always, immunization. Again, pertussis is part of the NIP. So, ayan, kasama yan sa DPT. Ayan, that's diphtheria, pertussis, and tetanus. Okay? Last condition, okay, is mumps. Mumps ay beke in Tagalog. So, it's also known as viral parotitis, epidemic parotitis, and infectious parotitis. Ma'am, bakit puro parotitis? Because mumps is actually the inflammation of the parotid gland. Okay? So, what causes mumps? It's a paramyxovirus. Then again, respiratory and fomite transmission. Incubation period for mumps is at around 14 to 25 days. So, this is the pathognomonic sign of mumps. As you can see, there is the swollen salivary gland. Okay? Remember, marami tayong salivary gland, no? So, ganyan siya. Inflamed siya. Swollen. Okay? Swollen. So, of course, clinical manifestations, apart from the swollen salivary glands, there can also be pain while chewing or swallowing, and there will also be low-grade fever. Headache, earache, muscle aches, okay, loss of appetite, dysphagia. So, ayan, all of them can also be manifested by clients with mumps. Okay? So, diagnostic test for mumps would include viral isolation. So, for you to really see the presence of the virus, diba? Blood exam, viral serology, serum amylase determination, okay? Because then remember, sa mumps, ang infected ay ang salivary gland. So, serum amylase is actually a salivary test, okay? So, it can help you determine the presence of the infection. It can help you identify if it's really mumps or not. Complications, ayan, isa pa rin tong mumps. So, habang tumatagal, among older clients, mas nagkakaroon ng complications. Now, for men, and this is the most dreaded complication, okay, is orchitis. Orchitis is inflammation of the testis, okay? So, kaya, it can also lead to impotence. For women naman, it's oophoritis. Oophoritis naman, it's the inflammation of the ovary. Again, ovary is where the egg cells are located. So, if it's inflamed, if both of them are inflamed, then the chances of conceiving a child is quite less likely. So, medyo nagkakaroon nga siya ng impotence, both for men and women. So, there is infertility. Let me just use the word infertility. Now, it can also lead to mastitis. Mastitis is inflammation of the breast mass. Pancreatitis, myocarditis, and hearing loss. Now, you'd be asking, ano bang management, ma'am, sa mumps? Actually, there's no special management. It's just palliative management or symptoms-based management. You have analgesics, antipyretics, then heat and cold application. Okay? So, for moms, definitely it's just rest. And then, cold compresses to minimize pain. And then, don't forget to get immunized. So, yan. So, I hope you learned something. So, please, do well on your exam. Thank you, everyone, and God bless.